Congresswoman.
I think you're getting gavelled there. Dr. Redfield, thank you for your willingness to hop on the phone yesterday with me. I know the White House called you away, but I do appreciate your willingness to take a little time. So I'll start with some of the questions that I was going to ask you yesterday. Oh, no, it's obviously the White House was calling, so I got bumped. It's all right. Is this a pandemic?
You know, I think the word, I think, is really not important. Usually the WHO is the jurisdiction that makes that call. This is clearly a massive global outbreak. Okay.
So I know that Chairwoman Lowy started out focusing on where she's from, New York City. I'm from a very, very different part of the country, a very rural district that I represent in the northwestern corner of Illinois. In fact, 11 of the 14 counties in my district are almost entirely rural. So as you can imagine, my office has taken the necessary steps to prepare for cases, and we're doing what we can to make sure that we're filling in people with what we know. So we have been in communication with all of our hospitals, our community health centers, our county health departments, et cetera. So one of the concerns that has been shared with us through this outreach is how the virus could increase provider shortages, especially in rural areas. And let me just give you an example to back up a little bit. One of the counties in my congressional district is called Henderson County. We have a patient-to-physician ratio of nearly 7,000 to 1. You know, if you want to compare that to Cook County, that's about 1,200 to 1. So you can imagine if rural doctors need to isolate themselves due to coronavirus exposure, there are limited options for our people. So I'm just wondering if you could offer, and anybody at your table there will maybe give folks, other folks an opportunity to answer this as well, but what steps can rural communities take to continue treatment if their providers get sick and cannot see patients? If you have any advice specific to more rural parts of our country.
Any of you want to make a comment? I'm happy to make a comment.
Please.
This is an issue, and this again is why we've heightened the area of infection control, because as we've seen now in Washington, we've seen now in California, we got 600 healthcare providers out of work in both of those environments, and that's causing strain. The source for most communities, if this is going to happen, is probably going to be a nursing home. Mm-hmm. And then they go into the hospital, and then the hospital, you know, you don't have diagnosis. Someone gets sick from the nursing home because someone came in and visited who just came back from Italy. They visited their sick mother in the nursing home, and then they got sick and went in the hospital, and then boom. So I think we just have to be aggressive in the infection control and really work hard, because you know this is what happened in Wuhan. That's why the mortality was so high. They had 130 infection beds when they started. They had over 20,000 within about 4 weeks. But you know what they didn't have? They didn't have doctors and nurses and equipment to staff those 20,000 beds. Their health system fell apart. And that's why the mortality was so high.
And are rural areas more at risk for something like this?
Well, you may have the benefit of being more isolated from a large population. So, you know, you pray that you pray that the virus doesn't really get into a community transmission zone. If it does, it's going to come through a nursing home, I would bet.
Is there anything from anybody else at the table who would have anything to add to what Dr. Redfield just shared?
And thank you for the question. I mean, rural health has been an ongoing issue for a long time. And like with a lot of other things that we've been talking about here, the coronavirus and the COVID-19 issue is just sort of shining a light on a number of deficits that we've had in our healthcare system and in our public health system for a while. We have been involved and have some resources. They're very small in terms of how it is that rural communities generally, not in this situation specifically, can have resources that they normally wouldn't have that might be helpful, and we can follow up and send you some of that information and talk to your staff about what's available and what are the kinds of things that we have supported generally that may come to bear for COVID-19 as well.
We'd appreciate that. Anybody else have anything else to offer? Okay. Something else that we've heard from nearly everybody that we've contacted as far as health providers is the respirators, latex gloves, eye shields. They've all expressed a need for more of this equipment. And I don't think anybody's asked this yet, but kind of the plan to make sure that this protective gear is out there for our healthcare providers.
Thank you for the question. This really is the important role, and I'm sure you'll have a hearing there, for ASPR to really look. They manage our stockpile. They manage. I will say that the interagency group has done critical analysis of, as I mentioned before, all the different things we need. You know, mask, protective gear. I know the vice president went out to 3M the other day to visit them with masks and try to see, you know, they're making about 35 million masks a day, but unfortunately only 4 million of those are for medical use, and about 31 million are for industrial use. And you'll probably hear more about that because I think ASPR and others will be coming up with a plan to try to see how maybe some of that could be modulated. But it's an ASPR issue, and we can make sure they get in touch with you so they answer that question.
That'd be great. Thank you very much. I'll yield back. Thank you.